What's going on, everyone? Happy Saturday. Hopefully, everyone is doing well, staying safe, healthy. If you had taken a COVID test, flu test, or a test for some other virus, I hope you have tested negative. If you did test positive for COVID, flu, or something else, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Saturday edition of the Virus Update for Saturday, March 15th, 2025. International Long COVID Awareness Day. Yes, today is the day we raise awareness to those who did not recover from COVID, who are having post-COVID issues, known as long COVID. That means millions of people around the world are dealing with that. And we are going to talk about that today. We're going to spend several minutes talking about that today. But first, welcome to my channel. If you're new to my channel, this is the channel where we do talk about long COVID. The latest virus news, the latest data, all to keep you safe and informed of what's going on with all these viruses circulating out there. It seems like time and time again, day after day, we find out new things that we did not know about these different viruses. And as we become more educated and aware, well, guess what? I like to spread what we learn with all of you to help keep you safe. You know, the news. I mean, there's been a lot of news lately, and it's not always good news. Sometimes there is good news, though. So I share that with you and everything else. If you want to stay informed, just subscribe down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And leave your comments down below in our growing comment community. And today, if you are dealing with long COVID, I want to know about it down below. Let us know what you're dealing with down below. I'm sure there are so many people here that can relate. I know I can raise my hand. I'm not going to give my story today about the 2 infections of COVID, but yes, I can raise my hand to long COVID as well. Alrighty, today we do have some news stories to go through. Then we're going to spend several minutes talking about long COVID. We're going to go through some other data, and then we are going to go through some weekly state data for COVID as well. I don't know how long this video is going to go. It may go longer than normal because it is International Long COVID Awareness Day, and this is something I do take very serious. All right, let's go to our first news story of the day. North Carolina sees a rise in whooping cough cases. Greenville, North Carolina. North Carolina has seen a dramatic increase in the number of whooping cough cases over the past 3 months. Between January and March, 106 cases have been identified compared to the 40 cases within the same time frame last year. Yeah, I would say that is a big increase. It's not a good thing. It's an increase we are seeing happen more and more in many different states. And remember, folks, a lot of the increases that we saw last year were higher than the year before. So year over year over year, things continue to get worse when it comes to whooping cough. Whooping cough is also circulating in Montana. Yes, Montana is reporting that whooping cough cases is increasing as well. Since December, Montana has seen 140 cases in 13 jurisdictions. That's not a good thing. New York City now. Bird flu is a problem in New York City, and the New York City Health Department is investigating after 2 cats have been infected with bird flu, and I have read in several different news stories on this matter that both cats have died. Then we move on to this. Coffee creamer products recalled after complaints of spoilage and illness. Yes, 2 varieties of coffee creamers sold in 31 states are impacted by or infected by this. And yeah, this is pretty bad that they are being affected, and more than 12,500 cases of 2 International Delight coffee creamer varieties sold at 31 states, including Florida, Texas, New Mexico, were recalled by the U.S. Food and Drug Administration, the FDA. Well, you know what? I'm going to say something. I hate to go down this route, but I'm glad the FDA is still at least doing recalls with all these cuts to various different agencies. Good to know that they're still going to do recalls. Select 32-ounce bottles of International Delight Cinnabon Classic Cinnamon Roll and International Delight Hazelnut coffee creamers have been impacted by this. Okay, moving on to this now. And you know what? We're actually going to skip over this for a second. We will come back to that. Apologies. Let's move on to this first. Measles in Oakland County. First cases confirmed exposure point in Rochester. So, yeah, measles in Glenn County. This go around, this is Michigan. This is the first case of measles Michigan has confirmed in Oakland County. It's the first case that I know of in Michigan this year. Like I said, I figured we'd be penciling in more states, and we continue to do that. Will it stop here? I don't know. Probably not. It'll probably continue. Will it be all 50 states that report measles this year? I can't answer that question, but this measles outbreak in the United States is not getting any better on a national scale. And of course, as you all know, if you saw yesterday's video and earlier in the week, Texas and New Mexico continues to get worse. Now, moving on to this, where we will start what's going on with long COVID. Get this, 1 in 8 COVID survivors will have symptoms 2 years after infection, researchers say. Yeah, 1 in 8 people are saying that they are dealing with long COVID. That's a lot of people. And a study out of Catalonia, Spain, this is just one study. There have been many studies, but a study out of Catalonia, Spain estimates that 23% of adult COVID-19 survivors developed long COVID, with 56% of them, or 1 in 8, 13% of those infected still experiencing symptoms at 2 years. Yikes. That's a large number of people. It is not a good thing. And let me tell you something. Long COVID can impact many different portions of the body. Really, there are over 200 different symptoms of long COVID. And you can see here, we actually have a section on my site for just long COVID studies. It's now up to 86 topics. I wouldn't be surprised if that very soon gets over to 100, because that CIDRP post that I just showed you that talks about that study from Spain, yeah, that's going in there, so that'll be number 87, unless something else gets posted. But yeah, COVID, long COVID, I mean, some people recover, right? Some people recover and they're fine. There's others that many weeks later, they're still sick. Many months later, many years later. Well, we're now 5 years out from the WHO calling COVID a pandemic. Guess what? 5 years later, there are people that were infected in 2020 and still not recovered. It is a real thing. There are many people out there that have this issue where they get COVID and they just never recover. Some people go on to get worse. Some of the issues that they continue to have, they then go on to die. Maybe it's a year out after having COVID. Yes, this is a real thing. You want to learn about long COVID? Go to my website, datareport.info, and go down to the COVID studies and papers section and click on the long COVID studies. We also do have some old posts in just the COVID-19 section in general for long COVID. Continuing on, we're not stopping with this. This is what the CDC says. We've done this before. We're doing it again because it's International Long COVID Awareness Day, and I need to make you aware. Signs and symptoms of long COVID. Long COVID can include a wide range of ongoing symptoms and conditions that can last weeks, months, or even years. I would add that there is about over 200 different symptoms that we know of long COVID. It's probably even higher now. Who knows how many it's up to now. And that was as of a couple of years ago. It was up to 200 symptoms. Most people with long COVID symptoms see significant improvement after 3 months, while others may see improvement up to 6 months after symptoms first appear. Some people, get this, may experience health problems from different types and combinations of symptoms that require comprehensive care. Long COVID symptoms and conditions can result in disability. Talk to your healthcare provider if you think you or your child has long COVID. I have done just that. First case, when I had COVID, yeah, that didn't go over so well. And eventually, my problems with the first case did gradually start to get better, although I had some new diagnosis. Asthma, yes, that was a thing for me. See, I said I wasn't going to talk about my case today, but you know what? It kind of helps you to understand this better. Second case of COVID, which I had just back in December, right after Christmas. Yet again, dealing with some problems from long COVID, and my doctor, who I have now, is taking me very serious. I have seen him several times. He's working with me. I'm very pleased with how he is helping me through this. Let's read on here. People with long COVID can have a wide variety of symptoms that can range from mild to severe and may be similar to symptoms from other illnesses. Symptoms can last weeks, months, or years after COVID-19 illness can emerge, resist, resolve, and reemerge over different lengths of time. Long COVID may not affect everyone the same way. Some people can experience health problems from different types and combinations of symptoms. Yeah. So let's just talk about some of these. We're not going to go over all of them. We're just going to go over some. I mean, if I sat here and named out all 200 symptoms, which I'll be honest with you, I don't even know what all 200 symptoms are of long COVID. But if we went through every single one of them, we'd be doing like a 5-hour video. Tiredness or fatigue that interferes with daily life. Yeah, I bet someone can raise their hand and type down below right now. They are so tired post-COVID that it is really impacting their life. It has maybe changed their life completely. Symptoms that get worse after physical or mental effort. So, let's say you had COVID. Several weeks later, you're back at work or you're doing something physical. Maybe you're doing some gardening. Maybe you went to the gym and you just do maybe a basic routine, just a little, and then all of a sudden you're like, really tired. Yeah, that's a form of long COVID. Fever. Maybe you had COVID and a month later you're still, you're burning up a little bit. You're still getting a fever. Yeah, that can happen. I can name I don't want to say celebrity, but a news personality will say, I guess you could say celebrity, Chris Cuomo. He has a program on the News Nation channel, and it's called Cuomo. That is the name of his program. Back when he first switched to that channel, he was dealing with long COVID, and eventually he did start doing long COVID segments, and it was very noticeable that he had fevers. His face would turn red, you could see the sweat pouring down, and he even admitted that he was having fevers. Yes, fevers can last a long time post-COVID. Respiratory and heart symptoms, difficulty breathing or shortness of breath, coughing, chest pain, difficulty breathing, shortness of breath. Yeah, COVID case 1, I had that. And coughing, yeah, COVID case 1. Oh gosh, it was really bad. And well, eventually, about a year or two later, I think it was a couple of years later, I finally went to a pulmonary specialist and yes, got diagnosed with asthma, which turned into moderate asthma. And now I get injections for that monthly. Chest pain, fast beating or pounding heart, also known as heart palpitations, difficulty thinking or concentration, sometimes referred to as brain fog, headaches, which is the big one for me. That is the one that I've been dealing with the most, COVID infection 2, sleep problems, dizziness when you stand up, lightheadedness, pins and needles feeling, change in smell or taste, depression or anxiety, digestive symptoms, and we're going to pause on this one for a brief second for story time. Digestive symptoms, diarrhea, stomach pains, and constipation. I did have stomach pains or some sort of a chest pain back with case 1 back in 2020. But I got to tell you, digestive symptoms, GI issues. I was once told by a GI specialist, well, COVID doesn't cause GI issues. Yes, it does. COVID does cause GI issues. And, yeah, to make the point, I did not go back to that GI specialist. Other symptoms, joint or muscle pain, rash, and on and on I could go. And some of these symptoms can get worse. Sometimes they can get severe. They can cause new conditions such as heart conditions, blood clots, neurological conditions, diabetes. Yes, there is a link to COVID and diabetes. And let me go back to the website for just a second. You can see here, we have various different archive studies, sections for all these different things. Losses sense of taste or smell. Yeah, that was the thing back in the early days of the pandemic. And for some people, that still does happen. Every once in a real while, I'll still hear someone say that, yeah, I lost my sense of taste or my sense of smell. So, yes, that is still a thing for some people. And let's be perfectly clear here. Long COVID, it can impact children as well. Yes, not just adults. It can also impact children. All right, this is some data. We got to go back to 2023. I was trying to find something from 2025 or end of 2024. Whatever, it's fine. We'll use this from 2023. Oklahoma, for the longest time, and as far as I know, still to this day, thought there was something more recent, but whatever. Oklahoma, the percent of cases that goes on to long COVID, 34.1% in Oklahoma. Yeah, that's rates of adults reporting long COVID symptoms. It's 34.1% in Oklahoma. Montana is 33.8%. Ohio's not doing great. 30% there. 29.4% in West Virginia. Pennsylvania is at 22%. Florida's at 27%. Alabama, 31.7%. California at 20.8%. Washington, 21.1%. I mean, we could go on here through every state. I'm not going to. Wisconsin, 24.3%. Michigan, 24.2%. Oregon, 25.1%. Yeah, take a look at this. Even Alaska, 24.1%. Hawaii, 21.1%. North Carolina, 23.3%. Maine, 23.5%. Some states are low. California is a little lower, 20.8%. Illinois is at 22.8%. Trying to find somewhere that may be in the teens. Washington, 21.1% again. Colorado, 23.2%. You get the idea here. Vermont, there we go. Vermont, 16.5%. And remember, Vermont at one time was the most vaccinated state. I don't know if they still are, but take a look at that. Higher amount of vaccine, less long COVID. And we know, even if you're fully vaccinated boosted, you can still go on to get long COVID. I've had the vaccine. I've had the booster. I did not have this year's booster, but I had Novavax last year at some point. I believe it was last winter. I had a dose of Novavax, and, well, here I am. I still have long COVID. Would that be the case if I had gotten a dose of Novavax prior to this infection? That I honestly cannot answer. All right, moving on. Taking a look at this. This is also long COVID. About 8% of U.S. adults have ever had long COVID, survey finds, and this is going back to December of 2024. And I can tell you this much. Around the world, there are millions and millions of people dealing with long COVID. All right, moving on. There's your little special on long COVID today. It's not going to be the last time you hear me talk about long COVID here. Anytime something new comes out, I will report on it. The wastewater viral activity levels in Canada. COVID-19 is moderate, flu A is moderate, flu B is moderate, and RSV is high at this time. I hope to get some more international data in tomorrow. There's a few people that tweet that out or post that out on X. I'm going to look for that later on, and I'll include that in tomorrow's update. So more on that in a little bit. Taking a look at what's going on with air qualities for today. This is important. We have to check this. Now, you're going to see some bad air qualities, I assume, in the southeast. There's a big storm system going on. Oh, take a look at this. Bad air qualities in the northeast today, with exceptions to Boston and right along that New England coast. But inland, yeah, that's not good air qualities. I can tell you here today, it's been cloudy, it's been dreary. I think the sun's just now coming out for the first time today. West Coast, bad air qualities in California today. That's not good. And some bad air qualities along the Gulf Coast. I thought this would be worse. All right, I have to show this to you now. Then we'll take a look at the pollen levels. There is a major severe weather outbreak forecasted for today. The Storm Prediction Center has gone with a high risk. Yes, that's the highest category for severe weather. For portions of Alabama and Mississippi. Let's dive into that real quickly. And you can see here the threat of tornadoes in Jackson, Mississippi, Birmingham, Alabama. We're talking population now. This is not good. It's up to 30%. That's about as high as it gets for that area. I mean, yes, the charts do go higher, but rarely do they go higher in that area. Wind threat today, yeah, it's there today. The hail threat. Please, if you are under any types of severe weather warnings, please take them serious. If you get a tornado warning in your area, please move to your safe space immediately, whether that be underground, the middle of your home, away from windows. Very important that you take those warnings safely today and take them seriously, because we want you to be safe here. I want to see you watching me in my update tomorrow, and I want to hear you say, thanks for alerting me of this. I had to do my thing to stay safe. But let's hope that doesn't happen. Let's hope you do not have to have a tornado warning. And I can show you this. There are already numerous tornado watches out down there. And, yeah, take a look at this. Particularly dangerous situation. That's about the worst type of tornado watch you can get, meaning things are really serious in that area. Alrighty, moving on because we have a ton more things to get through. Taking a look at pollen levels today. We do see less red on the map, but there is still a lot of red in the east. We also do see that pollen levels in Pennsylvania are moderate. Yeah, I was blowing my nose a lot last night, just constantly getting clogged up. The pollen levels, they are starting. We can see here in Texas that there is some red there, through the Mid-South, some red on the West Coast as well. All right, taking a look at what is going on in Pinellas County, Florida today, we do see things are very busy. And take a look at this. Not one, not two, not three, not four, not five, but 6 sick person calls. Yeah, the number of sick person calls starting to go up. It is spring break in the South, and you know what? There are people that do take vacations in Clearwater, Florida area, Tampa Bay area. I know personally, do know some people that used to go. I haven't talked to them in a while, but that used to go to that area because they were big baseball fans. And my city's baseball team does do their spring training and their spring training games in that area. So yeah, a lot of people go to the South at this time of year, and the South may start to see a little bit more illness because of that. They may even see a little bit of an enhancement in the level of COVID. I don't think it'll be a full wave, but and there could be more transmission. Nothing from Philadelphia today. Yeah, I don't know what their deal is. They did not post the Friday numbers, but I can show you this. Finally, some good news for today. Not very many calls right now in Montgomery County, Pennsylvania, but we do see stroke showing up a few times and respiratory emergency. Hopefully, we can look for similar results in Chester County. Yeah, a few calls out there, a lot of fall calls, but again, not all that busy. That's telling me the virus levels, they're dropping somewhat around here, but as you know, it is St. Patrick's Day weekend everywhere around the world. That could cause some extra cases here and there. We are seeing New York City and New York State, yeah, a little bit of a rise in cases there. Don't know what's going to come of that just yet. And Pennsylvania, we do see there are a few hospitals dealing with problems. And New Jersey, I think it's just two. It was two. Now it's just one, and that is in Mannington, New Jersey. All right, moving on from that, here's New York State real quickly, and we can see New York State yesterday. Yeah, there was that little bit of an increase, and we can see the hospitalizations there did not really go up this week. They went up yesterday compared to the previous day, but they're still down from last week and continuing to drop. All right, there was some new CDC data this week. We're just going to take a look at the COVID variant. We'll look at more CDC data tomorrow because we do have some new numbers from CJS to get through. LP 8.1 variant, that is at 47% at this time. XEC is at 26% at this time. Then there's a lot more variants underneath this. And I do want to point something out. Someone said to me, no, KP 3.1.1 is a new variant. Well, take a look here. You can see it's decreasing in amount. You can see I have it highlighted, and they show it to you in the green over here. And you can see in those green numbers, you can see it is dropping at this time. That is part of one of the many of subvariants that we dealt with last summer. So it is dropping at this time. All right, let's get to some numbers from CJS. And before we do that, I do have listed here. Look for the Sunday wastewater update tomorrow afternoon, which will include the news of the day and other data. I'm going to try and get through some international data tomorrow as well. And I'm sure there'll be some missed news from today because I just stopped searching for news today because I wanted to get that long COVID segment in there. So who knows what's going to happen tomorrow. I'll try to at least get to somewhat of a wastewater update. We're going to try for at least 5 minutes. Maybe it'll be longer. We'll know tomorrow. All right, let's take that hydration break. We forgot to do it yesterday, and we're going to need it because we have a lot of numbers to read here. So water is the drink of choice today. Very important that you keep yourself hydrated. Alrighty, let's go through Thursday's numbers first, and all except for New York and Puerto Rico in the Thursday numbers will be weekly updates. So New York, that was the daily number on Thursday, 1,439 new cases. Again, that was higher than last Thursday. Puerto Rico, 212 new cases, and we are talking about COVID here. There may only be just one flu addition added to that, and that would probably be California. Let's continue on. Puerto Rico, 212 new COVID cases. Colorado, a COVID test positive case rate of 2.9%, up from last week's 2.3%. That's not good. And 11 deaths reported by the CDC data tracker. Connecticut reports 420 new cases and 4 new deaths this week. Indiana reports 1,388 new cases and 14 deaths. A lot of this is from the CDC data tracker, so I think I'm going to skip over reading CDC data tracker over and over again. Massachusetts, 631 new cases, a net total, and 11 new deaths. Minnesota, 883 new cases and 17 new deaths. New Jersey, 1,668 new cases and 26 deaths reported by the CDC data tracker. Per the CDC data tracker, there have been 37,699 total COVID deaths in New Jersey. Remember, New Jersey has now switched to weekly reports. New Mexico, 270 new cases and 5 deaths reported by CDC data tracker. North Carolina, 488 new state-reported hospital visits. The CDC number for this week is significantly lower. 29 deaths reported by CDC. Ohio is mentioned in the video yesterday. Yes, I did mention that. Ohio had 2,943 new cases and 34 new state-reported deaths. And the CDC data tracker showed 50 new Ohio deaths. Remember, sometimes CDC is higher. Utah added 304 people to their living with COVID tab and 1 new death. New York for Friday. These are Friday numbers now. 1,315 new cases reported yesterday, and 7,490 cases were reported over the last 7 days. And to go along with 729 CDC reported hospitalizations this week and 30 deaths, and those deaths were reported by CDC. Puerto Rico, 180 new cases reported today, and 1,240 cases and 40 deaths reported over the last 7 days. Those 180 cases were from yesterday. Alabama, 210 CDC reported hospitalizations and 15 deaths. Arizona, 921 new cases reported by the state on Wednesday. CDC says 16. Arkansas, 7 deaths reported. California, 2,259 new positive tests, 47 new COVID deaths, and still 46 new flu deaths. Florida, 377 CDC reported COVID hospitalizations and 23 deaths reported. Georgia, 273 CDC reported hospitalizations and 28 deaths reported. Idaho, 648 emergency department visits and 1 death reported. Illinois, 434 CDC reported hospitalizations and 37 deaths reported. Iowa, 14 deaths reported. Kansas, 103 CDC hospitalizations and 4 deaths reported. Louisiana, this is a bad number, 1,012 emergency department visits and 6 new deaths. Is that number so high because of Mardi Gras, spring break? I don't know. That just seems like a really high number in Louisiana. And I get it. It's probably dropping, but still, that just seems like a lot. 102 CDC reported hospitalizations in Mississippi this week and 5 deaths reported. Missouri, 203 CDC reported hospitalizations and 11 deaths reported. Montana, 4 deaths reported this week. Nebraska, 283 new positive tests and a test case positivity rate of 7.1%, down from 7.4% last week. 6 deaths this week. Oklahoma, a test case positivity rate of 7.1%, up from 6% last week, and 21 deaths reported by the CDC data tracker. You see here why it's important not to follow the national trend. States, cities, counties, local areas can go off and do their own things. Some states are dropping, such as Nebraska, the positivity rate dropped. Oklahoma, it rose. Everywhere is different. Pennsylvania, 812 CDC reported hospitalizations. Good to see that number not over 1,000. And 46 deaths reported by the CDC data tracker. Still a lot of deaths happening in the state of Pennsylvania, my state. Not happy about that. Rhode Island, 4 new state reported deaths. South Carolina, 206 CDC reported hospitalizations and 11 deaths reported by the CDC data tracker. Tennessee, 8 deaths reported by the CDC data tracker. Texas, 2,097 new cases and 53 deaths reported by the CDC data tracker. Vermont, 4 deaths reported this week. West Virginia, 697 new positive tests. A test case positivity rate of 5.91%. And in this case, that is up slightly from 5.64% last week and 5 deaths. Wisconsin, 699, I think that is. Let's see. Yeah, Wisconsin, 699 new positive tests. A test case positivity rate of 4.5%, down from 5% last week, and 10 deaths reported. All right, the CDC this week added another 701 deaths since last week and currently shows 1,223,304 total U.S. COVID deaths since this all started, up from the 1,222,603 it was showing last week. Alrighty, folks, that does it for the Saturday edition of the Virus Update, which did end up being a very long update because we talked about long COVID on this International Long COVID Awareness Day. Again, if you are dealing with long COVID, I am so sorry that you have to go through this. There is just not enough being done in this country and really all around the world. There is not enough being done to figure out just what is happening with long COVID, why it's happening to so many people, and we really need to find more treatments because there are way too many millions of people that are dealing with long COVID. It is something that we really need to get a handle on, and really the best way to help at least prevent long COVID is not getting infected at all. We know masking works. We know clean air works, such as the air purifier behind me. Yes, it does work to help prevent cases of COVID, which can go on to cause long COVID. Alrighty, guys, I will see you again tomorrow. Until I see you again tomorrow, gotta do me a few things. First off, stay safe. Subscribe if you're new down below. Give this a thumbs up. Hit that notification bell. Share this video with anyone you know. And leave your comments down below. I'll see you all again tomorrow for the Sunday edition of the Virus Update. Until then, take care, everyone. Have a fantastic Saturday afternoon. And thank you so much for watching this very long Saturday edition of the Virus Update.